I am Dr. Biswajyoti Bandyopadhyay. Today, I'll be discussing on hypertension. We all want to remain healthy, and in order to remain healthy, one of the primary things that we should take care of is our blood pressure. We should maintain a normal blood pressure. But first of all, we must have some idea about what blood pressure means. We all have got the water supply from our municipal bodies, and merely having a line doesn't mean that we'll have the water supply. When the municipal water pumps are on, the pumps are creating a pressure difference, pressure gradient, along which water is flowing, and that's how we get our water supply in our residence. Similarly, almost all of our body tissues are being supplied with blood vessels through which blood flows. But blood flows due to the pumping action of heart. This heart is beating incessantly right from the beginning of a life to its end. But then what is blood pressure? Whenever heart is pumping blood, it is actually contracting and forcefully ejecting blood out of heart to the blood vessels and thereby producing blood pressure. And what is normal blood pressure? That's a range where if our blood pressure continues within that range, then that doesn't do any harm to our body. What is the upper level of this blood pressure? It is still debated. But generally, nowadays, we have arrived at a figure of 130 by 80. This is the upper range of normal blood pressure, above which, if our blood pressure goes above or beyond this range, then over a long period of time, this elevated blood pressure actually causes harm to our body. That's why this is the cutoff point, roughly, for our knowledge that we should maintain our blood pressure within this range. So, why our blood pressure gets elevated? It's not a one-day phenomenon or all of a sudden our blood pressure becomes high. It actually takes a long time for our blood pressure to get elevated. And if we are really uh, a bit vigilant, we can actually check our blood pressure intermittently and have our blood pressure within control range. So what is the harm if our blood pressure goes beyond 130 by 80? What are the harms done? In the long run, blood pressure will gradually increase if unchecked. And this increased blood pressure have got a number of hazardous side effects on our body. Particularly, we may have stroke, that is involving the vessels of the brain. There might be thrombotic complication or hemorrhagic complication, which ultimately may lead to different types of neurodeficit. Usually we are quite accustomed with paralysis. We can have increased blood pressure, which is actually going to jeopardize the retina part of our eye, and we may get blind. We can have increased blood pressure, which can actually jeopardize our cardiovascular health and may ultimately result myocardial infarction, which we normally know as heart attack, or even we can also have heart failure, which we call as congestive heart failure. And even our kidneys may suffer. So we may have chronic kidney disease, which ultimately may develop into end-stage renal failure or cardiovascular disease. We may die of it. So all of these dreaded phenomena can occur when our blood pressure goes unchecked and become higher and higher. Now, what are the common factors which influence blood pressure? The first one is age. The more we become older, the more is the chance of developing high blood pressure. Then there is another thing, that is a genetic background. It has been found that if a person who has got some other very near members of his or her family having high blood pressure, then his or her chance of developing high blood pressure is more than the general population. Now, these two are non-modifiable risk factors. We cannot change our age, we cannot change our family history. But then there are certain other modifiable risk factors like physical activity. If we are physically active, then the chance of development of high blood pressure gets lessened. As we go on doing exercise, our heart can also very effectively pump out blood without generating much more pressure. Then comes our food habit. Often we do go for increased salting. Often we eat do not have that amount of food which contain more and more potassium, like vegetables, fruits. We often take less of vegetables and fruits. They can have some changes in our blood vessels and heart, ultimately leading to high blood pressure. Another one is stress. Chronic stress is really unhealthy, and due to a number of and complex interplay between different neural and hormonal factors, chronic stress can lead to increased blood pressure. So if we consider all these things, and how easy it is to check our blood pressure, it only requires one simple blood pressure measuring instrument called sphygmometer. Even there are some digital blood pressure machines which are out in the market. You can jolly well check your blood pressure in your home, and that is nowadays mandated. Then one can actually go for home measurement of blood pressure, which is much better, because whenever patient visits a doctor, his or her blood pressure often shoots up by merely seeing or having the apprehension of getting checked by a doctor. This is known as white collar blood pressure. So, what is the normal range of blood pressure that we have come to know? It's around 130 by 80. And on the lower hand side, it is say around, even if a person doesn't feel dizzy or any other problem and is on without on any medicine, blood pressure lowering medicine, his blood pressure 110 by 70 to 100 by 70, that can also do. So if his or her blood pressure goes above 130 by 80, he should be very, very cautious. And if it goes past 140 by 90, he should always present himself before a doctor, seek his advice, and go accordingly. Now, here I want to mention one thing that often our patients say, Doc, look, I had pressure of 130 by 85 in the morning, and in the evening my blood pressure was 110 by 70. Here I must say that our blood pressure is not a static one. Blood pressure fluctuates throughout the day. So don't panic. It should be within the normal range, and that will help us. As I have told you, that lack of exercise with unhealthy diet can cause havoc, and actually these are the factors which can cause increase in blood pressure. So we can go for some simple measures like regular exercise, regular blood pressure monitoring, having healthy diet, and then just getting rid of some bad habits like we should quit smoking and reduce alcohol intake to the range that is usually advised. We can actually cut down the risk of development of increased blood pressure. And if we have got our blood pressure increased to that range where doctor advises us medicines, we should stick to the medicine, and we should regularly take medicines so that the non-compliance issue does not appear. It has been found that about half of our patients since regularly, and they usually end up in emergencies like stroke, heart attack, there might be blindness, there might be kidney failure. We can just get rid of all, we cannot actually land or in all this sort of trouble if we go on taking the medicines and having the usual healthy lifestyles, we adhere to it. So these should always be taken care of, like say regular exercise. A person who is normally active can go for a brisk walking like a period of 30 minutes for at least 5 days a week, and that can help him checking the blood pressure and maintain it within the control range. He should also always sticking to the healthy diets, like he should have good amount of vegetables, fruits, and whole grains. These are actually helpful in maintaining the cardiovascular health of our body. Else, if we do not adhere to this, if we are of sedentary lifestyle, if we go for fatty, fried food, take excessive, consume excessive energy, then we will be getting obese. And along with obesity, there a chronic inflammatory condition of our body will start, that is known as atherosclerosis, which actually helps in paves way for development of stroke, heart attack, or kidney disease like that. So simple measures, just go on checking your blood pressure. If it is in the hypertensive range, seek doctor's advice and stick to what he advises. Go for healthy diet, which usually uh, constitutes of more of vegetable, fruits, whole grain, less of saturated fat, and we should have a cut down our sodium intake to around 2 gram per day. So all these are called DASH, and DASH means dietary approaches to stop hypertension diet. And by going through all these measures, we can actually decrease our blood pressure by around 10 to 12 millimeter of mercury, which is fabulous enough. And that by only through these measures, we can have check on our rising blood pressure. So we must be very, very cautious. Just few simple measures can help maintain our blood pressure. And if we think about stress management, stress, chronic stress can actually go on to increase our blood pressure. We can go for meditation, yoga to control our emotions, and thereby we can get rid of this increased neurohormonal impulses, which can actually increase our blood pressure. So yoga, meditation, listening to music, something. So these simple things can actually help us reduce our blood pressure. And last of all, definitely, I should always emphasize that you should never, never discontinue your blood pressure medicine. And if you continue with all these few things, it is very easy in the beginning to have good control over your blood pressure, and thereby you can have check on the hazardous side effects of blood pressure. Often it is called silent killer, because often the patients, they do not have any symptoms of high blood pressure, so they go on having this high blood pressure. Ultimately they land in trouble. So simple things. Just be aware of high blood pressure, check your blood pressure lifestyles, and if required, seek medical advice. Continue your medication as per advice of the doctor, and you will be jolly well living a very healthy and fruitful life. Thank you.